Hello, we are the Association for Child and Adolescent Mental Health, or ACAM for short.
Hi, my name is Dr. Zoe Smith. I'm here to talk about our paper that was recently published in the Journal of Child Psychology and Psychiatry, titled Academic Motivation Decreases Across Adolescence for Youth Both with and Without Attention Deficit Hyperactivity Disorder, Effects of Motivation on Academic Success. If you would like to get access to this article, you can just put your phone up to this QR code and or copy the link above here. So you can look at this QR code, which is on every slide. Okay, so what are we talking about when we talk about motivation? Motivation, using the self-determination theory of motivation, focuses on three main areas. And so those three main areas are amotivation. So this is lack of motivation, difficulty or lack of interest in motivation. Extrinsic motivation, which is motivation by external reinforcers or outside presences. For example, parents or teachers putting pressure on students to do well academically, or a student wanting to learn something or do an academic task to get a good grade. So external reinforcers. And then intrinsic motivation, which is much more internal process, thinking about how are they interested in the work or task? Are they engaged? Is this something they're curious about? It's motivation that comes from within and not outside reinforcements. And so our team focuses on ADHD, which is a neurodevelopmental diagnosis that is characterized by difficulties maintaining and managing attention or executive functioning skills like organization, time management, planning skills, as well as may include symptoms of hyperactivity or restlessness or impulsivity. And these symptoms must occur before the age of 12. And so one thing that's important to note is often we see academic difficulties with people with ADHD because our education systems are not set up well for people with ADHD or other neurodevelopmental diagnoses. And so our educational systems often incentivize behaviors from teachers, from students, from parents that are not necessarily ADHD friendly. And so that is something that's really important for us to understand and look at what are other ways for us to increase academic success. Because very importantly, people with ADHD can be very academically successful. So we looked at multiple aspects of academic success, as you can see here: homework performance, math performance, basic reading, as well as grade point averages. And then we use the academic motivation scale, which again includes an amotivation subscale, intrinsic motivation subscale, and extrinsic motivation. So what we did is we used longitudinal structural equation modeling across 5 time points, as you can see at the bottom of the screen, with 302 adolescents, all of whom were in 8th grade, so around ages 12 to 14 at the first time point of the study, and ended in 10th grade and about 2 years older, ages 14 to 16, when we assessed for academic success. Half of our group of teens had a diagnosis of ADHD. We purposely sampled to have about half of our sample have ADHD and half of our sample did not have ADHD, but both groups could have other common mental health diagnoses like depression and anxiety. It was a predominantly white sample that was collected by in Virginia and Ohio. So we had two aims. We wanted to understand whether motivation across those 5 time periods changes over time and whether those changes differ based on having ADHD. And then we wanted to understand how motivation across time affects those academic outcomes. And again, whether there were differences for teens with or without ADHD. So what we found at first for our first aim is that at all time points, teens with ADHD reported higher A motivation, so that's up here, so higher A motivation than comparison teens. But interestingly, only teens without ADHD, these blue dots down here, actually significantly increased that apathy, that lack of motivation for academic success. And teens with ADHD, this marker here, it actually remains stable. So you can see it stays right around that, a little above 2. And so that's showing that teens with ADHD in 8th grade through 10th grade stay about the same level of A motivation to complete academic tasks, while teens without ADHD increase. Then for both intrinsic and extrinsic motivation, so up here, you can see again, the ADHD teens have lower levels of intrinsic and extrinsic motivation, and the teens without ADHD have higher levels, but both groups decrease across time. So this is really important to note that for all teens with or without ADHD, academic motivation is decreasing across a very important time period for teens in the United States to do well academically. So the transition from middle school, the end of 8th grade, to high school is very important for teens to succeed. And so this is very clear that we need to intervene at some level to help with academic motivation. That can look like a lot of things. It can be more system focused, so changing the school curriculum to be more engaging, active learning, allowing for UDL, designed learning. And so thinking through how to change our educational system to help increase motivation for our teens, make it exciting again. Our second aim, again, was to look at whether these different aspects of motivation were associated with academic outcomes. So for youth without ADHD, only A motivation and extrinsic motivation were associated with any academic outcomes. And as you can see here, they were only associated with grade point average. Our grade point average was an average of their grades in language arts, mathematics, science, and social studies or history. And so we can see that higher levels of A motivation were associated with worse grades, while higher levels of extrinsic motivation were associated with better grades. And this really makes sense because getting a good grade, doing well in school, having that pressure from external forces can actually get students to get a good grade. But what grades do not necessarily signify is learning and understanding. Because I know we've all crammed for a test, like studied really hard the night before, memorized everything, and then it just completely flew out of our brain the next day. And so what we don't have here in this study is actual learning of a subject and being able to engage with that work. And we imagine that the way that the education system is in the United States may be hampering that learning, that ability to have this intrinsic motivation to complete work. And a lot of it is from outside external pressures. then we see for the ADHD group that all aspects of motivation are associated with some kind of academic outcome. We can see that GPA is the only academic outcome that is associated with each aspect of motivation, which again, that makes sense because for youth with ADHD, they may need that extra boost of engagement and interest and maybe novelty and urgency that may come from intrinsic motivation to be successful academically and get these good grades. In addition, we see that there are a lot of other findings here. For intrinsic motivation, we see associations with homework performance, with numeric operations, which is an independent test. And so it mimics, it's a math test that kind of mimics homework or schoolwork. And so it makes sense that intrinsic motivation would be associated with this because we can understand that completing a task on your own is something that may require some kind of internal motivation, whereas math fluency right here is a time test. So that might be an external reinforcer that's helping students to be able to be engaged with that task because of the urgency of completing it. And so importantly, all teens are decreasing on motivation, and for all teens that affects their grades, which again are some of the number one things we use to examine colleges or how they did in high school. And so importantly, we do need to intervene and potentially change some of the ways that we educate our teens to become more neurodivergent friendly, as well as just increase engagement and actual learning instead of focusing so much on other types of academic work. And so future studies, I would love to see actual tests of learning, but those are kind of hard to do because we don't necessarily know what every teen is learning at the same time or what their curriculum is. So if this was interesting, please follow us. We have a lot of social media groups where we talk a lot more about ADHD, culturally responsive work, and clinical psychology in general. And again, thank you for listening to our video abstract.
Find out more about becoming an ACAM member and to be part of the advancement of child and adolescent mental health, visit www.acamh.org.